If I was to ask you the question, how do you clean in between your teeth? Because the brush can't get in between your teeth, and when you chew food gets stuck in between your teeth, so that does need cleaning out because that's where most patients develop holes and cavities between the teeth. So I actually floss once a day. Usually that's before I go to bed, before brushing. Once a day I think is ideal. It makes a massive change to your oral hygiene. Flossing once a day can completely change your oral health. Today I'll try to explain to you why. Here's the truth. Flossing, I personally floss once a day. That's before I go to bed, before brushing. I'll go ahead and start using some floss, then I'll brush my teeth, and usually that's a routine. To patients, I only advise flossing once a day unless there's a gum problem with the patient. Flossing once a day will massively change your oral health, and today I'll explain why it matters, what happens when you skip flossing, and how to make it super easy to stick with. Brushing is great, however with brushing only, you're not cleaning in between your teeth. If I was to ask you the question, how do you clean in between your teeth, because the brush can't get in between your teeth, and when you chew food gets stuck in between your teeth, so that does need cleaning out because that's where most patients develop holes and cavities between the teeth. So that's why it's very important to floss at least once a day, and you'll see massive improvements to your oral health. With flossing, you want to clean two surfaces between your teeth, because where the tooth joins together, there's two surfaces that need to be cleaned. It's just an up and down motion. And sometimes you can create kind of a C shape around the tooth surface, and that really helps clean off any plaque in between your teeth. The reason it matters is because if food gets stuck in between your teeth, plaque is going to build up, sugars are going to start to feed off the bacteria, will start to feed off the sugars, and that will create cavities, and that's when you need fillings, and that's why a lot of patients we notice who have holes are usually in between the teeth, because that's where the food is getting stuck. Bacteria is eating on those sugars and starting to eat away at the teeth. Usually with my patients, on most examinations, the biggest thing I notice is patients are not flossing. Once I've shown them how to floss, that's when they see the changes in their oral health. I have patients coming in every day who have not been in to see me for many years, and once they come to see me and I start getting them to use floss, either floss or interdental brushes. The TP brand is very great. It's a great tool to use, the TP brushes. They're little interdental brushes, they look like Christmas trees, and those go in between your teeth, and that can also really help clear out plaque from your teeth. I usually recommend those to older patients where they have a little bit of recession, and they find it difficult to floss. So then the interdental brushes, the little TP brushes, they're really great to use. I don't usually recommend them for younger patients. The reason why is because the gums have not receded as much, and sometimes those interdental brushes can poke the gums, and it can lose the nice profile of the gums. So I tend to avoid advising younger patients to use just a string of floss. As patients get older, I do advise using the interdental brushes as well as flossing just once a day. A patient, for example, comes to me, they have bleeding gums. They think it's normal. A lot of patients do think bleeding gums, they've had it all the time, it's just normal. However, it's usually down to them not flossing. Flossing just once a day, you can see massive improvements. Bleeding can go down from a whole mouth bleeding gums to absolutely zero, and I've seen this time and time again with patients. Once I've shown them how to floss and use the little brushes in between the teeth, the gums completely stop bleeding. Patients are a lot happier, and patients feel a lot better. Bleeding gums, patients don't think it's a problem because there's no pain there. However, in the background there's a lot going on. The gums are unhappy, and then the bone underneath the gum also becomes unhappy, and that also starts to wear away. And that's where patients start to see problems as they get older. It might go unnoticed throughout the whole adulthood until they reach 50, 60, 70. That's when they go to the dentist, x-rays are taken, there's no bone left around the tooth. The gums look fine, but underneath there's so much going on there, and that's when they start to lose teeth, and that's mostly due to them not flossing or cleaning in between the teeth. So that's 40% of the tooth surface missed twice a day for 30, 40 years. Patients won't notice it because there's no pain involved. unless some patients do develop abscesses, gum abscesses, but a lot of patients don't see that. They don't notice it, so they think everything's okay. However, it's only when you're older. Again, you might have seen your parents, your grandparents with missing teeth as they get older. Mostly down to them not flossing. It is a hard truth. That's exactly what's going on there, is they've not been flossing.